state invested in the development of a risk system, a risk and need assessment system. We recently rolled it out about a year or so ago. We recently trained some folks here in Michigan. This is what one of the tools gives the judges. So what they see is where the level of risk is for the youth. We made a speedometer with lots of colors because we are dealing with judges and we want to make it easy for them to understand the no. But then they see each of the domains: history, family, peers, education, pro-social skills, substance abuse, mental health, and values. And so they see where the youth risk is. And then over time, as that assessment changes, they see how it moves up and down. The third principle, and really one of the challenges, is how do you change behavior? So if you know who to target and what to target, that's really not that hard. Good assessment helps you do that. Challenge is, how do you change someone's behavior? By the way, it's not easy. If you think it's easy, try to change your own behavior. Try to give up a bad habit or lose weight. It's not an easy thing to do. The most effective interventions are based on behavioral treatment. Behavioral treatment has some attributes. They focus on current risk factors, not the past. Sometimes the past can be a barrier to getting at the present. But the problem is we can't change the past. So behavioral interventions focus on who you're hanging around with, and you're not going to school, and you're drinking, and you're hanging with a bad crowd, and you think what you do is okay. Those are current risk factors. Second, they're action-oriented, not talk-oriented. What do I mean by that? What I mean is that behavioral interventions use techniques that attempt to teach you new ways to behave. Not trying to talk them into it. They're not delinquents because they never got any good advice. Oh, they never got any good advice from you. That's why they're delinquent. And of course, they use appropriate reinforcement. We see the strongest effects in behavioral intervention. Unfortunately, a lot of what we do is non-behavioral. Most programs, I will tell you, is non-behavioral. Things like educational programs. Take a group of drug users and teach them about drugs. It's really a dumbass idea when you think about it. We do it all the time. Take violent people and teach them about violence. Or talk therapy. We want to use behavioral intervention. These are the most effective behavioral models. Structured social learning. Social learning is a complex process. It's not a complex concept. It's an easy concept to understand. How many of you have children? And how many of you turned into your children when your parents when you had children? Right? Most of us woke up one day and were our father or our mother. And that's the last person we were probably going to be when we were 14 or 15. I have one teenager left. And she said when she's a parent, she's going to let her kids do whatever they want. I said, you go right ahead, Al, you just be home at 10 o'clock. I turned into my father. I said things I swore I'd never say. You born in a barn? You think money grows on trees? I'll give you something to cry about. I said to my son one day, I said, Michael, do I look like Rockefeller? He said, who the hell is this Rockefeller? I said, I'm sorry, I look like Bill Gates. Family-based approaches that train family on appropriate techniques, and cognitive behavioral programs that target criminogenic risk factors. Family-based approaches, some that you run here in Michigan, MST, FFT. Okay. What's the research say? Average reduction, about 21%. But the most effective effects are when you target high-risk families, when you stay focused on criminogenic needs, and when you use behavioral approaches. I go to programs all the time, they say, well, they do family groups. What do? They bring the family in once a week and sing Kumbaya. That's not the same as a behavioral program where you're actually working with the family and scripting out for them how to handle those risky situations. Because I'm always amazed, who do they call? They call the judge to fix their kid. Or the probation officer. That tells you immediately they don't know what to do. Okay? Cognitive interventions that are based on thinking and the idea that when you have this distorted thinking, it leads to this distorted behavior. What's the research show? Average, about 25%, but if we do it right, we can get 50%. What goes into doing it right? Dosage, at least 2 sessions a week, fidelity, taking away barriers, targeting high-risk kids, and if it's combined with other services. Fidelity basically means make sure your programs are done with integrity. Why? Because the research says even evidence-based programs, even some of our stronger ones like FFT or ART, if they're done poorly, they can actually increase recidivism. We just finished a big study in Ohio, and that's exactly what we found. In some cases, not doing groups was more effective than doing them badly. And this is something you have to work on constantly. So what doesn't work? I got this from my friends in Oklahoma. It says, Lakota tribal wisdom says, when you discover you're riding a dead horse, the best strategy is to dismount. However, in corrections, we try other strategies, including the following. Buy a stronger whip, change riders, say things, this is the way we have always ridden this horse, appoint a committee to study the horse, that's a state's approach. My favorite, everybody does this, arrange to visit other sites to see how they ride dead horses. Create a training session to increase our riding ability, harness several dead horses together for increased speed, declare no horse is too good to beat, provide additional funding to increase the horse's performance, declare horses better, faster, and cheaper dead, study alternatives to dead horses, and promote the dead horse to supervisors. These are some things that do not work, programs that cannot maintain fidelity. If you're dealing with a program that constant staff change, constant leadership turnover, you can't get anything from them, it's probably, I don't care what model they use, it's probably not going to be effective. Things like shaming offenders, drug education, non-directive approaches. You know, what do you want to talk about tonight? Right? We've all seen those kind of groups. The most effective approaches are directive approaches. I'm going to teach you how to be less impulsive, and we're going to practice it, and we're going to work on it, and you're going to go out and try it. And when you come back, we'll see how that works. That's a very structured approach versus counseling. What does that mean? Give me 10 counselors, I'll give you 10 approaches. Bibliotherapy, make them read books, vague unstructured programs, and of course punishing smart. Things like boot camp and scare straight that we continue to see out there, even though we have a significant body of research that says these kind of interventions not only don't work, in most cases they increase failure. So with that, I'm out of time. My timekeeper here is doing a good job. Not that I pay attention to her, but I will stop now and take any questions you have. Not good. I get early for you. Yes?
Okay, you mentioned boot camp doesn't work.
Yeah.
You know, we do run a boot camp for, people who are older down in Chelsea. And as part of that boot camp experience, they do have things where they try to teach the offenders how to be less impulsive, how to be accountable for their actions, what could they have done differently to get a different response. So is it that these just don't work with kids, or that the boot camp approach with kids don't work, or would you take issue even with
anyone?
Boot camp?
Yeah, adult or juvenile?
Can I respond to that? I'm from the Department of Corrections. And what you're talking about, we used to call it a boot camp. Over the last 2 years, we've, like you said, completely reformatted it to a special alternative to incarceration, where we're doing evidence-based program. It's now a reentry center, and we're doing in-reach and et cetera, et cetera.
Okay, so you would not be following the same kind of program that a boot camp would be doing. And that's what you're starting to see the effectiveness?
Correct.
Yeah, I'd say the research adult or juvenile has not shown any positive effects. Small in some cases where they add treatment, but it's clearly not